cervical cancer, as I told, it is in the sexually active females, and the most common symptoms usually will be like intermenstrual bleeding, that is bleeding if it is occurring in between the menstrual cycles.
The most common cause of cervical cancer is the human papilloma virus, also known as HPV. Other risk factors include smoking, a weak immune system, and a family history of cervical cancer. The symptoms of cervical cancer can include abnormal vaginal bleeding, pain during sex, and pelvic pain. However, in the early stages of the disease, there may be no symptoms at all. That's why it's important to have regular cervical cancer screenings, which can detect the disease before it progresses. The most common screening test is the Pap smear, which is a simple procedure that collects cells from the cervix for examination under a microscope. If the Pap smear shows abnormal cells, further testing may be needed to confirm the diagnosis of cervical cancer. Now, let's talk about treatment options for cervical cancer. The type of treatment depends on the stage and severity of the cancer as well as the patient's overall health. In early stages of the disease, surgery to remove the cancerous cells may be the only treatment needed. In later stages, radiation therapy and chemotherapy may be used in combination with surgery. It's important to note that cervical cancer is highly treatable if caught early. That's why regular screenings are so important. If you have any symptoms or concerns, you could talk to us or to a care provider near your location. Thank you for watching this video on cervical cancer and its treatment. Stay tuned for our next video.